Maggie.
How are you? Good to see you.
Nice to see you.
I'm very excited.
Me too. You
Oh,
look good.
oh, you do too. Like your hair. Finally made it just in time. Just got off work.
Yeah.
You want to just wait for a few people to get on, or you just want to go ahead and get started? How do you want to do
I
this?
think let's just maybe have more people join in, and
Sure.
then we'll go ahead and start our first live.
I know that's exciting.
Yeah.
Awesome.
How was work?
Good, busy day. Yeah, and I told you about my phone situation.
I
But
know.
yeah.
Yeah.
For you guys, my son poured water on my phone and my phone wasn't working. Luckily, my husband came to the rescue and brought me a new phone this morning. So I'm grateful for that.
Oh yeah. I know kids and disasters. I'm sure is a thing that I haven't really encountered yet, but I'm sure I will soon.
Oh, yes, definitely. You will. Fun and tired sometimes ahead.
Yeah, yeah. Let me see. So now there's more people joining. There's about 34 people. Do you
Yeah,
want to kind of get
yeah,
started and then
definitely. Sure. You can go ahead and get the introduction going. So, do you want to go ahead and introduce
sure.
yourself?
So hi everyone. We're so excited to be doing this. This is our first live, and we're both physicians. We're both Black females in medicine, and we're both immigrants. So we're just, we thought this would be a good idea to kind of talk about our path, what we did to get where we are now. Talk about our lives, our schedules, our everyday kind of job demands. And so we're really excited to be here. So first, I'm gonna start by kind of asking questions, and then you can ask questions in terms of like our general like upbringing, where we were born, and what our schooling was like. I know you're from Ethiopia. I'm also from Ethiopia. So kind of talk about the transition, and then we'll go into our trainings and medicine and all the demands that goes along with being a physician.
Definitely.
So yeah. So Dr. Maki, if you want to introduce yourself very quickly, like what you do, where you are, and then we'll talk about like our early like upbringings and things like that.
Yeah, definitely. So my name is Magda. I can go by Dr. Maki on Instagram. I am a board certified radiologist, fellowship trained in body imaging. I'm currently practicing in a private practice setting for about a month, but I have been in a pseudo academic setting for about a year and a half. So yeah, that's me. And I'm currently in Maryland.
Okay. And then, I'm Dr. Beatty. I am an anesthesiologist, general anesthesiologist by training, and I did my fellowship in global health and equity. And so I'm currently working in private practice in Northern California. And, I was born and raised in Ethiopia. We'll go into that soon. So I can go ahead and kind of talk about that if that's fine.
Sure. Yeah, let's do it.
Yeah. Okay. So, I was born and raised in Addis Ababa. My family, my mom and my dad are both from Ethiopia. My mom was born in a small city called Jimma. I'm sure a lot of our followers are Abisha, so they might know it. And then my dad was born and raised in Gojam, the northern part, and they both had a very different upbringing. My mom was kind of born in a kind of a wealthier environment. My dad was born in a very poor environment. So when they met, their goal was to kind of get us, the best education they can, and get us to the next step. So in Ethiopia, I went to a French school actually. So I went in a French school system. So I spoke French and learned English when I was in sixth grade, I think sixth or seventh grade. My spoken English was terrible, but my writing was fine. But most of my schooling was done in French. So my goal was, when I'm done with my schooling, for me to go to France and continue my training in France was kind of our goal. But then, a lot of people know the DV, diversity visa lottery system, and my mom got it, and so my entire family moved to America. So that's kind of my early childhood upbringing. I was always been very studious. Like I used to be a nerd, and my friends now who live in DC, I have pictures of me with my glasses and my big braids and everything. I loved school. I loved science. I loved math and like just biology in general. I've actually thought I was going to be a surgeon since I was like 10 or 11. I always told myself and my friends I'm going to be a surgeon. I ended up doing anesthesia, which is very close to surgery. Um,
Yeah.
yeah. And so that's kind of my little background story.
Awesome. Yeah.
Yeah.
Pretty similar story, I guess, for me as well. I grew up in Addis Ababa, born and raised there.
Yeah.
I actually went to Greek school for the first, I guess, till eighth grade, seventh grade. And then I went to Cathedral for 2 years, or 3 years, sorry. And 1 year I was at Nazareth School. And then my senior year, I came to the US. I went to a boarding school for a year. And then I was at a small Christian college, liberal arts college in Tennessee for a year or for 2 years, then transferred. So I've been like everywhere. A lot of transition, a lot of adjustment that I had to do. And also very, I guess, nerdy. I was always a good student, I would like to say, if I may say so myself. Loved the sciences, loved math. So transitioning into medicine or going into medicine seemed like the right path, the expected path. So yeah, that is my background.
Yeah.
And
Awesome. And one question in terms of background, one question I had from the followers
yeah,
yesterday on the comments is a mother who just moved to this country with her daughter from Ethiopia and or I think Eritrea. But she was asking, like my daughter has a big cultural shock, of like moving to a new country, and she was asking for advice and things like that. So I don't know if you have any like advice or how, like if you were shocked by the culture when you moved first, and then if you had any advice in terms of how to mitigate that.
yeah, definitely. I mean, the best thing to do is just immerse yourself within the culture. But I really recommend having similar friends that are in the same, setting, in the people that can relate to you, because just being the only one can make it very difficult. The transition can be shocking. From my personal experience, when I came to the US, the boarding school I was in had a lot of Habesha people, Eritreans and Ethiopians.
Hmm.
Some had been there for a little bit longer. So the transition wasn't too harsh. And I was also not thrown into like New York City. I was in the small cornfields of Iowa. So the transition was smooth. I slowly learned the culture, language, little sayings here and there. You will catch up on, get involved in your community, in your churches. Those are the things that I would really recommend you doing. If you're not in the same setting I was in a boarding school, if you're in the city, just getting involved in your community, I think is the best way to do it. But definitely having other Habesha people around you that have been through it that can help you and guide you. I think mentors are also something that I
Hmm.
would recommend.
Yeah. So someone is saying, Eleni Way is saying, I was shocked when I moved here and got stressed out for a couple of months.
Girl, yes, I believe that. It
I
doesn't
know.
matter. Even
Yeah.
people that move from like the North Dakota to California will be shocked. There will be a cultural shock, let alone people traveling thousands of miles.
Yeah. Yeah. No,
So
I feel the same way. Yeah. So when I moved, I was 16 when I moved. And for me, it was a bigger shock because I didn't speak much English
yeah,
and my whole entire school system was in French. I went to lycée in Ethiopia. And
yeah.
so I moved from Addis Ababa to Los Angeles, which is a huge city. And I
Oh
went
my
to one
God.
of the most underprivileged high schools in Los Angeles. So that was a huge shock.
Uh,
That was a huge shock. Yeah. And
yeah,
so yeah, and so I just remember, being very confused because our school system was, first of all, very different in the lycée. Like it's different in terms of like you don't pick your classes are assigned to you, so you just show up. If you're starting 11th grade, you show up and you have a set like curriculum and schedule. Here, when I started at Westchester High School, the counselor was like, "What classes do you want to take?" And I'm like, "I don't know.
yeah. You get a
I had no
sign.
idea." Yeah,
Yeah,
I had no idea. I was like, I have
remember.
no idea. Like, what should I think? And so they had to translate my whole transcript that was in French to English and figure out what classes I need to take and stuff. And I remember one advice one of my friend told me who lived, she's also Abasha, who moved a year before me in DC. I remember her calling me. She said, don't let them put you in ESL because you're better than
Yeah.
ESL. And she's like, you're gonna waste your time in ESL. And so I remember telling my counselor very frantically, I don't want to be in ESL. Was my
Yeah.
broken English. And so it was a lot of figuring out the system and just understanding the system. And then ultimately, like for me, I wanted to go to medical school. I knew that early on. So I was trying to make sure, like, how do I get to college? Was really like, I need to understand the system
Yeah.
early on and quickly enough, because I was starting 11th grade, and then I was going to go into 12th grade. So I only had 2 years. So I
Yeah.
was like, I just need to figure out what to do to get to the next level. So I remember constantly being in my college counselor's office. So for high school students who are watching us, or who parents who have kids who are watching us, I think it's really important to really have a connection with your college counselors in high school, who have a wealth of information, including like scholarship opportunities, just
Absolutely.
helping you apply for college and things like that. So I was always there. I was always there.
Yeah.
And then, in fact, my sister, who's a year and a half younger than me, ended up being a college counselor as a student, because we were there so much that we knew the system, that she ended up being a counselor, like a student counselor or whatever. And
Yeah.
so I think the shock is definitely there. Like for me, the biggest shock was not being able to speak really good English. So
Mhm.
I when I came, I was naturally timid and kind of shy, which is so different now. But I
Yeah.
wasn't. I wouldn't talk unless it was extremely necessary to talk, and I was so ashamed of my accent, which I
Oh.
think is something that we need to be okay with. Like people have
Yeah.
accents, and it's okay as long as you understand, you're able to understand what they're saying. So I felt like having an accent was like not a good thing. So I was not willing to talk. And then
Yeah.
through time I realized, oh, it's fine, it's fine as
Yeah.
long as people can understand what I'm saying. And
Yeah. That's one
so
thing that bothers me actually. People associate having an accent with stupidity or like someone that doesn't have knowledge. But we have like so many attendings and so many, people that we're around with heavy accent that are just super intelligent. So I
yeah,
definitely agree with having to just speak up. Don't be ashamed of your accent. It is who you are. It just tells a story, tells where you come from. So definitely agree.
yeah. I think Burka's hi Burki, uh she's saying, I think there is also
Like a
a lack, yeah, of support and encouragement within the Habesha community, as well as directing and advising students who are new and just started the journey.
Absolutely, absolutely. Actually, that is one thing that motivated me to do this today is because I didn't have that when I was going through the process of applying to medical school. No mentors, no people that have gone through it. Unlike my other friends and classmates, who had like their dad is a doctor, their cousin is a doctor, their uncle is a doctor, or they know someone in the community. Like for us, it was just like nobody, nothing. We had to figure it all out by ourselves. And definitely there is no direction, there is no
Yeah,
advertising. There's nothing out there for us. So I definitely agree. So, which is why us who have
yeah,
been through it need to be more proactive about reaching out to people that are interested in applying to medical school, as well as people that are interested also need to be super proactive, because
yeah,
nothing will come to you. You have to go and look out for it. So whether it is reaching out to people on Instagram or like Facebook or other social media platforms, I think it's necessary. We are there. We will help. We've been through it. We understand what it feels like to not have that support. So
mhm.
please reach out.
Yeah, absolutely. I totally agree with that. In fact, I'm sure you know, but there's a mentorship program I started called Muru Mentor. And
Definitely.
so it's for pre-medical students who are underrepresented in medicine or disadvantaged. And so
Yeah.
we connect them basically to physicians who are underrepresented. So this is for pre-med students who are going to be applying to medical school within the next 2 years, to guide them to the application process and things like that. Because it's so important. As you said, we had no support. Like for me, again, I'm the first one in the family going to medical school. We're
Same.
both immigrants. We're
Yeah.
just understanding the system. Oftentimes, our parents are also struggling, working multiple jobs. We're not very financially stable as well. And
Yeah.
so all those factors are such huge stressors, especially when you're trying to take your prerequisites and do all these
Oof.
extracurricular activities and take the
Absolutely.
MCAT. All these things are such big stressors. So if you know anyone who's a pre-medical student within the next who are going to be applying to medical school within the next 2 years, go on the Mulu Mentor page. It's Mulu Mentor, MULU Mentor, and then send us a message.
Definitely.
Yeah.
All
So
right.
so in
Go ahead.
terms of medical school, so tell
Yeah.
me more like about how did you end up going? Well, first like college, your college experience and being a
Yeah.
pre-med in college, and how you were
Yeah.
able to make that leap to medical school.
Yeah, so I first started out in a small college, liberal arts college, and I think that was I don't want to say that people go there don't succeed, but that was a very big mistake for me, I would say, because since I was not aware of, the different opportunities out there, going to school with such limited resources, I believe limited me for the first few years. Therefore, I
Mm.
had to transfer to a bigger university afterwards, and that's when I started to really delve into what I needed to do in order to succeed in obtaining a medical, going into medicine. So, um, I did that and I started to do research. Every summer I was doing something towards medicine, and another big hindrance that I had was I did not have a green card. Therefore, you know how it is, you can't
Mm.
work, you want to
Yeah.
be a research assistant, but no one wants to hire you because you don't have. So I was always on the phone, literally, like I would spend hours every day trying to find a PI that would take me,
Mm.
for the summer research. I would just volunteer, getting into extracurricular activities. And that's not just being a member of something, but actually holding leadership positions. So I did that. And because I had to transfer, and also I needed a green card. There was a year delay between med school, undergrad and medical school, but I was able to obtain all of that successfully, thank God, and apply to medical school right after. So during that year, I did research. It's always recommended for you to do research. It looks good on your resume. You learn a lot about bench work and how you can like translate that into actual medical practice. So that is what I did. In
Mm.
terms of medical school, that was quite challenging. I mean, as you, I'm sure, remember, the biggest thing for me was I was in school in the South. So primarily very few Black students and like no Abisha students in my class. We had one class before me and a class under me. But just, even after having lived in America for like 7, 8 years at that point, there was still that like feeling of not belonging and you're different. You always feel that. And that was very challenging for me. I mean, I wish I knew now what I knew. I wish I knew back then what I know now. I would have been more, you know, I would have just like pushed myself into things, but it made me like withdraw a little bit. And I was a little bit away from family a little bit too. So that kind of makes it difficult for you to, it was a challenge, I would say. And then I guess residency, I went to residency where there were a lot of Habesha people,
Oh,
and
nice.
that was
Okay.
that was amazing. That part of it I really really enjoyed. But on the downside, I was away from my family, literally Michigan to Tennessee.
Wow.
And I highly recommend having an excellent support system when you are going through training and through medical school, because there are so many challenges, and having a good support system and family, I feel like, is vital
Yeah.
to your success.
Yeah, for
You
sure.
know,
So yeah. So for me, I from high school I went to college and I had a number of choices. I did pretty well in high school. Let's just say that. I think for coming from Ethiopia, we get a very strong foundation in math and science in general. That's what I've seen in general. So a lot of the high school science classes came naturally to me, and I did well. And
yeah,
so I ended up going to UCLA for undergrad. And so I went from in LA in an underprivileged high school to this huge campus. UCLA is a huge campus. My goodness, like there's so many students on campus. Like at 10 a.m., 11, 10 a.m. when everyone is awake, going to classes and stuff. I mean, it looks like I don't know how to describe it. Like it's so busy. There's so many people on campus. You feel like a number pretty
yeah,
much. And so if you're used to being in a small classroom, like in high school, where you have or like there's 30 or 40 students in a classroom, you
yeah,
immediately feel like you're lost, you
yeah,
know? So sometimes I tell people, like, if you're the kind of student who needs that one-on-one attention, go to a smaller school. If you're okay deal with like doing, if you're able to be
Rose.
accountable, then go to a bigger school,
Yeah,
you know? And so I just remember the first like 3, 4 months feeling like, oh my gosh, there's so many people. And then I spent the next few months saying, oh my gosh, this is a huge campus. Just walking is so tiring.
yeah,
Like going from my dorm to my science class, honestly, from like if I walked normally would take easy 20 to 25 minutes. It's just so, and this is just like, and if you're going slow, it would take 30 minutes. And so you just have to plan your life around that campus. It's
yeah,
crazy. Like if you're leaving in the morning, then if you want to come on in the afternoon time, not only are you going to be sweaty because you're going uphill, but you're going to be so tired.
Yeah.
It's going to mess up your entire day. So initially I was like, I don't know if this goes for me, you know? And as like, and as a pre-med, I was like, oh my gosh, like how am I supposed to ace, like do well in these classes? Everyone here is so smart.
Yeah.
And I'm obviously the only minority, like our, like organic chem, physics, all those classes are like
Oh, for
easy,
sure. Yeah,
right?
definitely.
It,
Absolutely.
yeah, those are like, my classes for OChem was like 300 students, like easy. And usually it's 350 to 400, and the first 2 weeks people drop out, and the professor makes it very clear that this is a hard class, that you know, like he's like, you know, a fourth
Yeah,
or a fifth,
kind of thing. Yeah.
yeah, a fifth of the students are going to drop out. So, you know, be prepared to drop out, have a plan B. So already like the first 2 weeks, you're like, oh my gosh, I'm going to fail this class, you know, and
Yeah.
you're already so stressed out. And you're the only minority in the class. Oftentimes you're maybe it's like 5 people, like minorities in a class of 300-400, you know? And so you
Wow.
just feel kind of lost. There's no support
Yeah.
oftentimes. Thankfully, there's for me at UCLA they had the program called AAP, which is, what is it called? Something advancement placement. But it was like a minority like tutoring program that they had. So I used to go to tutoring a lot. So I always tell my pre-med students, if you need help, even if you don't need help, it's never a bad idea to get extra help. So, you know, these OChem classes are like an hour long or something, right? Like you maybe have it like twice or 3 times a week, right? You have like about an hour to kind of grasp an idea. And so the rest of the grasping, either you do it on your own when you're studying, or you do it in a tutoring session or small group discussion sessions, you know? And so
Wow.
I remember for a lot of my science classes just going to tutoring. So I was getting tutoring myself in a bigger classroom where I'm able to grasp more concepts. And then I also tutored students, you know? So it was like a give and take scenario
Yeah.
where you're always kind of like, okay, like I tutor students, I get tutoring for the classes I need help on. So I just remember as a pre-med constantly bouncing from one class to tutoring to small discussions to tutoring.
Yeah.
And it's just like nonstop, you know? And so that was kind of my experience in undergrad. And obviously, as you said, we need a lot of leadership like roles
Yeah.
to apply to medical schools.
Yeah.
So it's not enough to just be a member of a group, you know. People are
No.
looking, yeah, and so people are looking for leaders, because as a physician, you're ultimately a leader. You know, you need to be comfortable with the saying, hey, this is what we're going to be doing now, and leading a team. And so having those skills early on in your career, like training, is very important. That's what people look at, you know, when you're saying, oh, I was like the president or co-president, or I organized this and did this. It shows initiative and leadership. So it's really important to be part of organizations and leading some of those organizations, you know?
Definitely. Yeah. Like, it's not about just fluffing your resume as well. It just, you do gain a lot of leadership experience that is going to be very vital when you're leading medical students as a resident, or
Yeah.
residents as attending, or, like it builds up the confidence to communicate with other clinicians, referring physicians.
Yeah.
So definitely being involved, and not at like a group member capacity, but as a leader is vital.
Yeah.
Absolutely.
And
There's,
yeah.
sorry, go ahead.
No, no, go ahead.
Yeah, there was a direct question towards international. No, I was not an international student, so it's very difficult for an international student to apply to medical school in the U.S. It's like practically impossible, honestly. So that was the reason why I had to wait a year after I graduated from undergrad to apply. So yeah, no, I was not an international student. I had my green card at that time.
Hmm. Okay.
Um,
Um, there's a lot of questions. We'll get to it soon at the end, maybe. We'll go scroll through
okay,
all the questions and get to it too. And so
sure.
what was I gonna say? About extracurriculars. So yeah, so a lot of pre-meds ask me like, what extracurriculars should I be doing? You know, especially
Yeah.
when they're first and second years. And for
Mm-hmm.
me, I usually answer them, do something that seems natural to you and fun. Like definitely don't do something that you hate doing. There's no
Yeah.
point of being
For
part
the
of it. yeah,
your
of an
res
organization. Yeah, just because you want a leadership position, don't do that. Do something that is interesting, but I think growing within that organization shows a lot of promise. Like, I started off as a member. The second year, I was the secretary. The third year,
yeah,
I was the vice president of the president of the organization. It just shows that you're able to go up the rank. I think that shows really good
absolutely,
improvement,
definitely.
right?
Yeah, because you're volunteering in these organizations and groups, so definitely has to be something that piques your interest and you enjoy. Definitely needs to be something within medicine, but not always. I mean, it looks better when you like volunteer. So my brother is also a resident actually. We volunteered at a school clinic, like we'll go to
Yeah,
elementary schools and volunteer at school clinics. And then like blood pressure measuring at like some health fair or, those kinds of things you can do. At churches, I did that as I was a camp counselor at a church, for a summer camp. So yeah, like different things that you can do where you can stay
yeah,
within your, give back to your community, gain some leadership skills and also, enjoy yourself and have fun.
yeah. Yeah, I agree with you. Same thing. I did some medicine related stuff just like you did, like volunteering, like the health screenings and things like that, where we take blood pressure and like, check the people's sugar level and things like that.
But
Um, but I also did things that was like completely outside of medicine, which I absolutely loved. So I did a thing was diversity. Like I really like diversity, and I think diversity is something that should be celebrated. So I organized one of the what do you call it? Like there was like a week long. It's called World Fest at UCLA, where each day of the week there is a celebration of different cultures. So others like the dorms will have different like Mexican food and other kind
uh,
of like different like Filipino food, and
yeah,
then we'll have a day of like cultural performances and dances. I
yeah.
really enjoyed it. It was great. I helped organize it, and then I was like, and when they asked me during interview why I did that, it's completely outside of medicine. I said, I really value diversity, and I think
Oh,
that
for sure.
makes that brings a new perspective too.
Absolutely. One of my closest friends, actually, I met through an African student organization
Yeah,
in college. So definitely, I agree with that.
yeah.
That's awesome. Yeah.
How about, and then another question I get a lot is shadowing experience. Like, what do you think of that?
Yeah, I really want to talk about that actually. So I actually never did that as a pre-med student. Never. And the reason why is because who am I going to shadow? I don't know
Mm-hmm.
anyone. Who's in
Mm-hmm.
medicine?
Yeah, yeah,
That was one of the things that really made me sad is like, who do I ask? Where do I go? Where to begin? So I feel like, we should be presenting ourselves out there as people that other, medical students, pre-meds can actually shadow. So I never had the opportunity to do that. I think it would have been a great opportunity. First of all, you get letters of recommendation.
mm-hmm.
Um, and also having the like knowing what really practical medicine is. You have an idea in your head as a pre-med student what medicine entails, but really you have no idea. You haven't even like touched the surface. And I think the best way to do that is actually what do you call it?
The shadow.
Like shadowing, absolutely, yeah. Shadowing a physician. So yeah,
Yeah,
I think it's great. I don't know what your thoughts are. What do you
yeah.
think?
Yeah, I agree. For me, initially I started shadowing mostly because it was kind of like people really recommend it. But
Yeah,
I think it's very important to shadow
yeah, yeah.
because oftentimes you don't shadow physicians, you don't know what's going on, and you get into medical school and you don't like it. You don't
Exactly.
want to go, yeah, you don't want to go through all the hassle of getting to medical school and not have an idea what you're getting yourself into. And
Sure.
so I highly recommend to get that kind of experience. But as you said, it's so difficult, especially if you're a first generation student going to medicine. You might not know anyone. So
Exactly.
yeah, so what I did for me, I didn't know anyone. So honestly, it's kind of desperate. But what I did is I went on the UCLA's medical
Girl, there's
physician
nothing
website.
that's
I
yeah,
started emailing people individually. I started
yeah.
literally be like, I'm a pre-med, I need someone to shadow, blah, blah. I think out of like the 30 emails I sent, someone responded and I got lucky. But it's just
That,
like the struggle we go through. And then also I knew someone, it's a long story, but I knew someone who knew someone. Like this is how it works. You know someone who knows someone, right?
yeah.
Who knew a physician, and she connected me with another. It was the surgeon who let me shadow him in clinic. So that worked out. But that was a connection I had. So I think
Uh,
first of all, it's important to have connections, and it's hard to have connections if you don't know anyone. But even volunteering, you know, in the hospital, that's how you make connection. Like volunteer,
Yeah,
being a volunteer, and then, you know, if you're volunteering in a clinic, you meet the physician there or the PA or the NP, and then you put your name out there, and they connect you with someone, and that's how you get, you know, those experiences. It's not easy at all, you know.
yeah. Definitely. And another thing, I think research is also really, I don't know, like the same thing. I was always told like you have to get yourself into research, you have to get yourself into research. So I mean, it may not be very interesting to a lot of people. I know that, but it looks
Yeah,
good on your resume. If you're
yeah,
slightly interested, I think, you know, understanding what goes on behind the scenes in terms of research and translating that into medicine is very important. I think that is why I
yeah,
think they encourage for you to do research. And
yeah,
I really recommend that some people get
yeah.
into that and look into it. I mean, you may even consider doing like an MD, PhD, or you know, something like that. So I did the same thing that you did, and I emailed literally a bunch of people, called a bunch of people until I got into a few labs. And
Yeah. Yeah.
you know, that was a lot of times when I was interviewing for different positions, they would bring that up. They would say like, "Oh, what kind of research did you do?" Oh, you know,
Yeah.
it piqued their interest. It kind of diversifies you, and you're like multifaceted. So
Yeah.
I don't know. I definitely
I
would
totally
recommend.
agree. Yeah, I agree with you too. I don't think research is mandatory, but it does look really good to set you apart, especially if it's an
Yeah,
interesting research and you've been doing it for some time and you did a poster presentation. Publishing, I think, is really hard in research, but even if you
it
did
is.
a poster presentation somewhere, you know, I think that looks really good. So I also got lucky to do some research. My research paid me; it was my job, so I got really lucky. And when I was in
Yeah.
undergrad, my initially I started as a volunteer, so I think it's the starting point is really volunteering.
I mean,
Start
you
as a
have to.
volunteer,
That
you
just
know,
can't be
because
true.
yeah, you bring no skills, right?
Yeah, yeah,
Like I
absolutely.
had no skills whatsoever, so I went into the lab. I said, "I'll do this for free." Pretty much.
Yeah,
Look, you don't
yeah,
have to pay me. I'll do this for free. I learned the skill. I acquired the skills, and then once I had the skill, I'll be like, "Hey, you need to start paying me for this."
hey,
Pretty much
hey,
because not only I need money, because I told them I have a separate job that I'm gonna be spending a lot of time on because I need the extra income. So if you pay me, then I spend more time in your lab. I do more of the work, and I get paid. It's a win-win situation,
hey.
you know? And so they hired me, and I spent so much time in that lab, mostly because I was getting paid.
Yeah,
Yeah,
that's wonderful.
yeah. So that was the research portion. I'm trying to think what else in terms of pre-meds. I'm trying to think all the questions. MCAT. Oh, we should talk about the MCAT.
All right, I can tell
So,
you, I did mine.
yeah.
I took a Kaplan course.
Okay.
I took a Kaplan course, and then I'm one of those people. I'm a perfectionist. I'm like, I'm gonna study this thing till there's like nothing left to know. And after my Kaplan course, I didn't register for the exam. I kept studying and studying and studying. My mom was like, "When are you taking this exam?" Like literally, like every day. And then finally, it had it with me. She literally had to drag me, have me
Yeah.
register for the exam, and then I finally took it. So Kaplan course for however long it lasted, I can't remember. Then 2 months of studying by myself, and then I just took it once, and it was good. It went well, so I didn't have to take it again.
Nice.
But you know, I would recommend that you take it your junior year. One
Mm.
thing a little outside of the MCAT that I really want to emphasize is that like plan out, map out what you want to do during your first year. Like
Yeah.
remember, take, you know, map out. I need to take all the prerequisites and all that stuff. Figure it all out during your first year. That way you will know that junior year you're going to take your MCAT and then you'll be done. Senior year you can apply. That way you don't have to waste time. And
Yeah.
then another is you don't necessarily have to major in like the sciences. You don't have to, you know. And I think you could minor in business and do all kinds of different things. All you need are your prerequisites. Of course, there are some courses I think like anatomy and physiology I would recommend, and biochemistry I would recommend taking. But other
Yeah.
than that, I really don't think you need to drown yourself in all these science classes
Yeah.
and make your college experience
Yeah.
difficult for absolutely no reason. Once you're in medical school, there will be time for that, I believe. I believe that, you know, the more knowledge you get in medicine, it's like you're going to be narrowed in into medicine, and you can't really like go out and do any extra things, like unless you want to delay your training, you know?
Mhm.
So while you're still an undergrad, you know, take all these fun, interesting classes and like, I don't know, like widen your wealth, like knowledge, and instead of just taking all these science classes and being like and limiting yourself onto one box, take a business course or all kinds of different things that you can do, and then have your classes and prereqs in line so you can take your MCAT junior year and then apply.
Yeah.
So
Yeah.
that's my 2 cents about that.
Yeah, I agree. So for me, actually, my major was I had my undergrad experience was really interesting. Again, I was like 3 years in this country. I'm still trying to figure out the system. So initially, I went in being a physiological science major at UCLA because I was like, that's very close to medicine. I'm gonna do it. It's one of the hardest majors on campus actually. And then I just did my first year, took my prereqs, all that stuff, my first and second year, and then my minor was in French because I really did love French and I wanted to do something with it. And then third
Mm-hmm.
year came and apparently, I took a quarter system. I took 1 quarter, and then the second quarter, I was like, I'm ready for my Phi-Sci classes, my upper division classes. And my
Yeah.
counselor was like, oh, you missed the rotation. It's only one class is only offered once a year. So
Yeah.
that means I have to wait until next year to start my Phi-Sci major and stay there for 5 years. I'm like, no, I don't want to stay there for 5 years. So I was like
Yeah.
panicking, big time panicking. Third year, this was like it was third year. And then so I was like, what do I have to do? And so I was like, okay, minor, I'm gonna declare my French minor to a
Mm-hmm.
major. So I decided to upgrade from a minor to a major in French and just drop the physiological sciences. And incidentally, I had taken all my prereqs already because I've already taken those things for medical school. So all I needed to take is the remaining French classes that I've been taking, and I only had like I think 4 classes left. And technically, I'll be done in 3 years.
Yeah.
I would be done in 3 years. And so it was kind of a shock because I wasn't ready for that plan. And this new plan happened in like I think end of December, early January when that's my second quarter. So I was like, oh my gosh, okay, now I'm gonna be done in 3 years. Didn't plan for this. I was gonna take the MCAT next year, but now I have to take it this year because otherwise I'll have 2 years off. I was like in full mode of panic, panic, panic. So I was like emailing everyone I know, like physicians I know, is it okay to major in French and still apply to medical school? Can I still get into medical school? Back then too, it wasn't a non-traditional major, it wasn't something that people like have heard of before. Now it's like whatever, right? Now it's, anyone can major in anything you want. Literally any major can get you to medical school.
Yeah. And it makes you
But
more interesting, I think, to be
yeah,
honest with you. Sets you apart from other people that are all in like the sciences. So
yeah.
yeah, go ahead.
So what I did is in my franticness, I was like, I need to take the MCAT. So I signed up for a Princeton review course in February as I'm taking all these classes, trying to finish early. And then did that for a month, studied for a month, took the MCAT, and did poorly. I did poorly on my verbal part. My sciences have never been an issue.
Yeah.
So that was fine. My verbal was like almost like zero. It was terrible. And so it brought my whole score down. And
Yeah.
technically, I mean, I still applied with it because I was like, let me just see if it flies. I got a few interviews and I got rejected, which makes a lot of sense because it was not a good score, overall score. And so that was my goal. So I was like, I applied, I finished early, and then that year I ended up tutoring students because I was still applying to medical school. I tutored a bunch of students in LA, and I had a tutoring gig on the side. I just worked pretty much for my gap year. And did some research. The research I was doing, I did on the side. And then, of course, I didn't get accepted to medical school. And so I was like, oh my gosh, I knew my application was fine. The only thing that was the issue is the MCAT score. So I needed to study for the MCAT. And then initially back then, I was like, I think my major being in French maybe is a deterrent. So I was like, maybe I need to show them that I can do science. So I ended up doing my master's in pharmacology and toxicology, which was a great decision. Like I learned a lot about medicine. I did all my anatomy, pharmacology, physiology, all that stuff, graduate level courses. I did
Yeah.
research. So it was a research track. So I did a bunch of research, did a poster presentation, and I took my time studying for the MCAT, and then I did well and I applied to medical school. And so
Yeah.
I think it's important to show people like not every time your plan is going to go the right way, especially with the MCAT. I think a lot of us, especially immigrants, struggle with the MCAT because of the verbal part of the verbal is hard. I find it extremely hard because it's not your first language, and you're required to think on a higher level. I don't know. I always found the verbal parts like extremely difficult.
I
And
completely,
so
definitely, even to this, I mean, like, English is not our first language. So like writing papers and, these
yeah,
poster presentations, it doesn't come
yeah,
naturally to me. You know what I
no,
mean?
yeah,
So I get it for sure.
yeah. Yeah.
Yeah.
And so I always tell people, like, if you didn't do well on the MCAT the first time, it's not the end of the world. I do agree, give it your best the first time. So I
Oh,
do tell people, I wish someone told me when I was taking the MCAT back then that I wasn't ready. I knew I wasn't ready. Absolutely knew I wasn't ready. But I was like, no, it's fine. I'll wing it type of thing. Like you've done exams
yeah.
like that. You cannot wing the MCAT like that at all. Same thing. Same thing with your board exams. You cannot wing your board exams.
Oh
You
my
know what I mean?
PTSD, don't
So
remind me.
yeah, and so I was like, I did not wing it. But now I tell people, like, if you don't feel ready, if you take practice exams and you're not scoring consistently like a score that you think you're gonna get on the day of, then
Yeah.
there's not gonna be a miracle on the day of
Yeah,
your
'cause
exam.
it's basically your record,
Yeah,
when like you were lucky enough to get into a program and take some time off, but for some people maybe they don't have that opportunity. So yeah, definitely be
yeah,
prepared. Be crazy. Don't be crazy like me and take too much time and be anal about it. But I think, reasonably, like she said,
yeah,
check out your scores, see how you're doing, and then yeah, go from there.
yeah. And so anyhow, I made it to medical school, and then medical school was fine. I don't think I had any huge challenges in medical school. Again, I think the being the only minority in some of your classes is there. I mean, I wasn't the only minority, but I think there was like 10 of us in a class of 150 or so. But
Yeah,
you do feel like a little bit isolated,
definitely.
Um,
Uh,
you don't feel like you had that support, so it helps to have people who have the same mindset around you,
def-
and reaching out, like I think asking for help when you feel like you need help in medical school is fine. If you feel like you're not doing well. Yeah.
Absolutely. Yeah, we had anatomy tutoring courses, which like everyone went to. There's no shame in asking for help.
Yeah.
It's
Yeah.
actually dumb to not ask for help and then end up somewhere you really don't want to end up. So
Yeah.
definitely, yeah, and in every way, not just for school. Like if you're mentally drained, if you feel like you're having anxiety,
Yeah.
because these issues that you need to cope with and deal with. Otherwise, it's
Yeah.
gonna hurt you from reaching your goal. It's gonna hold you back.
Yeah.
So
Yeah.
definitely reach out to anyone and everyone. I mean, whoever family, mentors,
Yeah.
classmates, or whatever. Definitely.
Yeah. I agree. And yeah, and I feel like with medical school, you have to have an idea of what you want to do, kind of, as you're going through medical school. Like, you don't have to know on day one, but I think when you're doing your third years, when you're discovering the different specialties. And so
Yeah.
some specialties you have to know ahead of time, unfortunately. Like dermatology, you kind of have to know early on that's of interest of you. Like orthopedics, neurosurgery, all these like competitive specialties
Yeah.
that kind of require a little bit of preparation ahead of time in terms of doing research, publishing, shadowing, all that stuff. Those
Yeah.
things you have to be aware that, hey, if I want to go into derm, I need to start like doing some derm work early on. And so getting mentors way ahead of time is really important. Yeah.
Absolutely. I agree. I agree. I remember, like, my brother is a urology resident, and that boy knew early on what he wanted to do. I'm like, why are you killing yourself? Like, no,
Yeah.
I'm like, don't kill yourself. Don't be a surgeon. But he's like, that's what I want to do. And so early
Yeah.
on, he went on away rotations, like
Yeah.
early, like third year, and he was doing all of those things. So definitely,
Yeah.
I doing all his research and all that stuff. So I think it's important that he's lucky because he had me. I
Yeah.
was a guinea pig. So like anything I did, he would just follow, piggyback on that. And which is amazing. I'm
Yeah.
so glad to have been that for him. And
Yeah.
hopefully I want to be that for other people as well. And I know you've started that mentorship program that you have as well. So it's kudos to you.
Thank you. Thank you. Um, so yeah, and then after med school, residency, I guess. Any thoughts about residency? I feel like residency is brutal. It's you work all the time. People don't understand how many hours you put in, and so in residency, my first year I did internal medicine in my intern year, and I was fine. I was in San Diego. It was beautiful. I had a group of friends that were amazing. The class was great. Like, I honestly did not feel the pressure intern
Because
year.
you weren't going into medicine because you're doing
That's
anesthesia.
why, exactly. I wasn't going to medicine.
Yeah,
But then I did feel the pressure in anesthesia for sure. When I started, especially anesthesia, because you don't learn any anesthesia in medical school, you don't learn any anesthesia in residency, so it's all brand new. So I
agree.
remember, like, as
Yeah,
a same thing was radiology, right?
yeah,
Like, yeah. And so I remember my first year, my PGY 2 year, my first year of anesthesia, I was opening up books and I was like, oh my gosh, I can't believe I'm doing this again. Like I'm relearning all these things
Yeah, from scratch.
from scratch that I haven't learned in medical school. So I
Yeah,
remember thinking like, why did I do this again? Like, you know, but and then the stress is anesthesia initially is a very stressful training because it's high acuity. You don't know what you're doing. You're doing big surgeries. You're dealing with a lot of personalities, which includes surgeons, you know, some
surgeon.
nurses in the OR, your attendings, the patients. I mean, everyone is kind of coming at you, you know, and so it can feel a very frustrating and isolating field. And you're in your own room, like, you know, in
Yeah,
internal medicine, you're around in teams. You have that camaraderie. You can
yeah,
talk about a patient all day as you're
yeah,
typing your notes. There's no sense of urgency most of the time, you know. But
yeah,
anesthesia, you're isolated. You're by yourself in the OR. There's no one you can really talk to sometimes. You're
yeah,
doing really difficult cases. So it felt very isolating, I think, the first year. And then we had so many exams. My gosh, anesthesia has so many exams. Like my first year I had 5 exams. My second year I had two. My third year, I think it was two. And we have 3 board exams. So it was too much. Like you're
yeah,
constantly studying, like constantly studying. And so I was so tired. By my first year, I was like, I'm so tired. But then you start getting the hang of things, you know, and then it starts becoming fun. You know, it
yeah,
starts like, okay, I know what I'm doing. This is fun. This is interesting, you know. But
yeah.
I don't know. I felt residency was just very tiring.
Oh, absolutely. I mean, and I had a kid during residency, so man,
Oh,
oh man, I feel it. It was rough, rough. And I
yeah.
had my daughter actually 10 months before I took my boards. And I
Wow.
think our board exam is probably one of the harder ones. We have 2 board exams. We have
Yeah.
one during our 3rd year, like PGY 3,
Yeah.
or no, PGY 4, sorry. And then we have one after fellowship. So 15 months after graduating from residency. And that one is a little bit easier. But the one during 3rd year, I literally have like PTSD from it. I mean, oh, it's just, it was hard. And all those nights and,
Yeah.
sleepless, you're up all night, have to be back in like 8 hours. And yeah,
Yeah.
it's definitely challenging. My transition, I did a transitional
Yeah.
year, and that
Yeah.
was fun. That was a
Yeah.
lot of fun. Yeah, I really enjoyed that. I think that was a good pace, like med school, then just slowly ease into residency. But then PGY 2 year was a shock as well, because it's like, what is this? Like X-ray? What? Like, oh,
I
you
know.
know what I mean? Physics? Are you kidding me? Like, I thought
Yeah.
I was done with all of that. And
No.
yeah, but you get through it. You just, for people that are going into medicine, you have to want it. You have to want it, and you have to realize that there's really nothing else you can do, because
Yeah.
physical burnout is real. You
Yeah.
will be so exhausted. But for me, what was comforting is knowing that there was really nothing else I wanted to do. I'm like,
Yeah.
okay, I'm dying here. Why am I doing this to myself? And then I'm like, what else do you want?
Yeah.
Girl, what are you going to do? Nothing.
Yeah.
So then you just
Yeah.
push through, you know what I mean?
Yeah. Yeah.
Yeah. So definitely make sure that that is something you want to do. Like, I have this thing in my head, when you're like, you have this strong desire to do this medicine, all right? You really want to do it. Then if you want to do it, like, do your research, know it. And then if you are like, for sure, you want to do it, then be dedicated, be determined, and be super proactive, And then after that, be persistent. Be
Mm-hmm.
super persistent,
Mm-hmm.
because failures and obstacles are going to be there. Don't be
Yeah.
discouraged. Don't, so we just keep pushing through. And yeah,
Yeah.
I think my biggest thing, throughout throughout like
Yeah.
pre-med, med school, residency, and I just, as an attending, just
Yeah.
always for that.
For sure. I feel the same way. Obviously, residency is difficult because you're tired all the time. You're working all the time. You're learning. That's what people don't realize. You're not just working, but you're learning at the same time. So you work in the hospital, and you go home, you study for these exams, and you go back and work again. So it can be very discouraging sometimes, especially if you don't feel like you're doing well in exams, or you get a bad evaluation from your attending, even though you feel like you're doing your best.
Or you get
That
yelled at.
or get yelled at
Yeah.
by someone or a patient. The patient can,
Or,
it honestly takes a little bit to take you off.
dude, no, I know. I mean, and another thing, patients, like, as minorities, like, that's one thing I think that I loved residency. I mean, like, the people I was around, I loved it. But from patients, it was so hard, because it's either, are you are you my physician? Aren't you too young to be my physician? Or you would get, are you the tech? you know.
Yeah.
Like a lot of times I would walk in with my tech and she'd be like, okay, we're going to do this, you know, like a procedure to do. And then, you know, he would just be looking at her. She's like white, and he would be talking to her. And I'm like standing there like, what's going on? And then she would be feeling embarrassed. Oh, like, oh, she's the one that's going to be doing your procedure. And I'm like, I am Dr. Haila Mariam. I'm going to be doing your procedure today. And I could see like this entire shock in their face. And, you know,
Yeah.
those are things that we
Yeah.
deal with. I continue to deal with it to this day, even as
Yeah.
an attending,
Yeah.
you know. And what are you going to do? I think one thing I
Same.
would recommend for physicians that are minorities is always dress the part. You know, always look professional when you're going
Yeah.
to work, because unfortunately, when they see us, they don't see doctor. It's like either, you know,
Yeah.
there's nothing wrong with being a nurse, but my mom's a nurse actually. But they're like,
Yeah.
oh, are you the nurse? Or are you
Yeah.
here to take my tray? You know?
Yeah. Yeah.
So dress the part, be confident, don't take nonsense. I mean, obviously you're in a professional setting, but also be stern, especially women.
Yeah.
You know, be strong, stern, and because that's how you get respected.
Mm.
So that was one
Yeah.
thing I think I learned from residency, and it was a bit challenging and annoying.
Yeah. Yeah, I mean, definitely. I think microaggressions, the most microaggressions actually come from patients and not always, especially for when you're in training and not just from people like your attendings or other people in the hospital. They mostly
Yeah,
come from patients. And so it's interesting because the patients are not, you can't really talk back to patients. They're protected. So it really, honestly, a lot of the time we rely on other providers to step in and say something, like saying, hey, she's the physician, I am the tech, you can direct all your questions to the physician, and it's something very kind of like professional,
yeah,
I've asked patients before why they thought I wasn't the physician, like simple questions like, is there any reason why you didn't think I was a physician, and it's a very non-threatening question, and it's I'm not confrontational, I'm not aggressive, but it's a simple question that makes them think that, oh, why did I think she wasn't a physician, and that kind of makes them think, and most of the time they're like, oh no, I didn't think it. It's like, it's okay. I just, just sometimes I wonder, it's, I am the physician, my biases physician, and I presented myself as a physician, as Dr.
yeah,
Asnafe, and so I do call out people sometimes. It really depends on my level of energy. Some days I'm like, it's 6 a.m. I'm not dealing with this today. I'll be like, I'm gonna ask my questions and leave,
yeah,
but you really pick your battles, and it can
yeah,
really get to you sometimes, if
for
it keeps
sure.
on happening so often, you
Yeah,
know. And that's why
definitely.
I think training, like microaggression training and things like that, is so important in the medical setting and system. But anyways,
Yeah,
okay, it's almost time. Do you want to go through the questions in the chat?
yeah, for sure.
Here, I'm gonna scroll all the way up and then go one by one and see if there's anything. If you see anything, you can, address it.
Sure.
Let's see. Okay, let's see. Oh, someone said, can we talk about mom guilt when you go back to work and send your baby to daycare, especially during COVID and all? How did you ladies deal with it?
Uh,
I don't have kids yet. So, Dr. Maki, this is all you.
Sure, I'll take that. Oh my goodness. For me, this was a very big challenge, especially after I had my first, my daughter. I had suffered from postpartum anxiety that I didn't even realize until recently. So leaving her with anybody was painful for me. Like it was just so difficult. But if you deal with these kinds of issues, I think you should seek help. I think you having a family and support system around is vital. But dealing with mom guilt, I don't think it'll ever go away. But I think you have to realize that you are going back to work for her, or your son or your child will see my mom is strong. My mom is providing for us, and then also you need to go to work. For me, I love my job. I mean, I'm fulfilled as a mom, but I'm also fulfilled as a physician. I feel great about myself. I love being able to work and then come home to my babies. I feel great. You have to remember that, like, you went through schooling and training for such a long time to be this, whatever profession you're in. So it's important to go to work. You are an individual. Take care of yourself, and then come back and take care of your kids. I think it's great. I don't think it's everyone needs to be a stay-at-home mom, and being a stay-at-home mom is probably one of the most difficult jobs in the whole world. So I think, mom guilt will not go away, but just realize that this is something you have to do and it's going to benefit both you and your kid. In terms of sending your kids to school, so I told this to someone. My daughter went to school since she was one. She's been in school since she was one. For COVID, there were 3 months where like everything shut down and that like no one can go to school. During that time, we kept her home. But right after, we saw like a change in behavior. She was not one of those people that could stay home. She's very social. She loved to be in school. So as soon as school was open, we sent her back. And for us, it was more like risk versus benefit. We saw that the risk of her staying at home, which just wasn't good for her. And also, both my husband and I are physicians. So the risk of her contracting COVID at home versus school wasn't going to be that different anyway. So we just went ahead and sent her to school. And she thrived. She's doing fantastic. She has not been sick. And knock on wood, my husband and I have been good as well. So yeah, that's how we
Awesome.
do it. Yeah.
Yeah. Great tip. There's another question for you too, I think. It says, I'm an international student. I think earlier you said something about it's really hard for international students to go to medical school.
Yeah.
And she's saying, does that mean it's unlikely 100% according to Dr. Maki? And someone else is saying, is it not? I believe it's very hard, especially for funding reasons, but not impossible.
It's not
So,
impossible.
yeah.
It's
I mean, nothing's
impossible.
impossible, right?
Yeah, but it's very difficult. You know, getting
Yeah.
into medical school is very hard. They have like a tier of who they accept. You know, and especially I think in California it's even harder. Like you have to be like a California resident. They'll take your money. They'll accept your applications. But chances are you will not be called for an interview. They will even give you a secondary because you pay for your secondary, and then that's it. You know.
Yeah.
So yeah, there may be my scholarships and all that stuff, but it's very difficult. There's all tons and like thousands of people applying to medical school where there is just like 150 or whatever, like 300. I don't know. For my class, it was about 150 students, so, and there were thousands that applied. So you can imagine.
Yeah.
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 And what else? Are there other questions?
Yeah, so there's Ali, she's asking, what do you suggest for a current senior student planning to apply the cycle? It was hard to volunteer as well as shadow for the past year and a half. I feel like we don't have that much hours. I agree. I mean,
Yeah.
honestly, right now,
COVID.
a lot of with COVID, it's extremely, you can't come into the
Yeah.
hospital. Medical students and other volunteers were banned. So
Yeah.
what people are doing is web shadowing. So on Instagram, there's something called web shadowers, and there are other people also doing that where you can shadow someone online. So it will be like someone presenting about their job, and that you can say that you've done that. I think it's reasonable to say, hey, I've done some web shadowing with this physician who's an anesthesiologist, radiologist, and I got kind of a glimpse. It's not the same, obviously, but it can help. I think research or quality improvement projects that you can do from far that don't necessarily have you be in the hospital is something you can explore. So, reaching out to, I don't know, physicians who have things that, any
Like,
way you can help with the project. Yeah,
like
go
you
ahead.
can do some data collecting stuff that,
Yeah,
researchers are doing. You don't necessarily have to do like bench work or so yeah, there are opportunities. You just have to reach out to people. Be proactive. Those people are not
yeah,
going to come to you. So
yeah,
reach out to those
yeah,
people that are interested in doing their research. And then
yeah.
gap year. Did you see that question about gap year?
Yeah, I did see that. I mean, we talked about it, I think, extensively when we talked about what we did after undergrad.
I think
And
you're cutting off.
can you hear me now? Yeah, I was
Okay, yeah,
saying
yeah,
how we kind of touched on it. I mean, you can talk about it more, but I
yeah.
feel like I talked about it extensively. So
Yeah, I mean, if you have an extra year, I did research and I actually got paid for it at that point. I had my I was able to work, so I got paid for it. It was fun. So I think research is the best way to go, especially if you have not gone into medical school yet, because they're going to ask you, what are you doing right now? And you're applying, and you can say, I'm currently doing research. I'm doing this, this, and that, and it just looks good. Looks like you're still within the science fields, and I would recommend doing that. Or I mean, something that will pay you, because shadowing is not going to pay you. So staying within science is, well, that is what I did. So
yeah. So
I
you can also, yeah, and also you can be a scribe in the hospital. You get great experience in the ED where you scribe and you're in the emergency department, you get paid for it. Some people choose to be an EMT. It's not a long training
oh,
course and become
that
an
is also
EMT. Yeah.
Yeah.
So you can do a lot of stuff. Like you can do a medical assistant where you check in patients, take the blood pressure, vitals, get paid for it. You can learn how to draw labs and things like that. I have one of my mentee who's doing that. She's a medical assistant. She got the job. She didn't do any kind of schooling for it. She just got the job because she was pre-med. She checks in patients. She gets paid for it. And then now she's doing vitals and things like that. It looks good, you know?
Nice.
So those are, yeah, those are options.
MA,
Doc, huh?
MA to be a medical assistant, you don't need a training? Or is
She
it just
didn't.
because she's
Yeah,
pre-med?
she didn't get. She's pre-med, and they were looking for someone. And they hired her. I don't think I'm not sure if you need actual formal training. I mean, some bigger hospitals, I'm sure, would
Probably.
require some experience beforehand. But she
Okay.
found a small office that was able, willing to take her. But
Nice.
she's also very proactive. So you just have to be very proactive. She's the kind of person who she will, I could see her getting that kind of job because she's super
Yeah.
proactive. Um, Dr. Benjamin is saying, very impactful advice, ladies. Thank you so much. She's my dentist actually in
Oh,
San Francisco. So if you guys want a dentist, visit Dr. Benjamin. She's awesome. I've canceled on her many times because I'm so busy. I'm so sorry, Dr. Benjamin. But I'll see you soon. Yeah, she's awesome.
nice.
Let's see.
Did your parents understand what you wanted to do, and how did that help you keep in mind that they didn't have experience with the American system? Oof, did my mom was pushing. I mean, if they like, I
Yeah,
feel like my MD should go like next to her name as well, because she is
yeah,
very vital
yeah,
to. I mean, she helped me get to where I am today. Not she didn't need to understand the system. All she knew was she needed, like, I had to study. I mean, like, study, study, study. And my mom would bring me food to medical school, like tons and tons of food, and freeze them for me.
yeah,
So I mean, there are so many ways to support your child without having to know the American system,
yeah,
loving your child and praying with them. I would call my mom before every single exam, and we would pray together. And my
yeah,
mom went to all my medical school interviews with me. That's the type of like support system that I have.
yeah,
All med
yeah,
school interviews, all these like step one, step two exams. Like, my mom would drive me there,
yeah.
so yeah, they don't need to understand the system. You just have to love your child and be committed to their, desires and dreams, and support them.
Yeah, I totally agree. Same thing. Again, for me too, my mom, my dad passed away a long time ago. So she's been the same thing you did for you. She did for you. My mom did the same. And so I think having a supportive family is vital. I don't know how to really describe that. I know some family might not be supportive and not understand the path. Medicine takes a long time. It's a long process. It's not like something you just go in, get out. And so I think expressing that to your family is important. Like both of my parents were educated, so they come from an educated background, so it's very easy for them to understand what that means. But if you have parents who are not educated, it might be hard for them to understand. They might want you to work and do this and that, but you have to really sit them down and tell them, hey, this is my goal. So even with me, because I finished undergrad, I had almost a year off, and then I applied to grad school. All that stuff was kind of like fluid and like what's happening with your life type of thing. So I had to tell my parents back then. I say, hey, this is my goal. They all knew I was going to go to medical school, but they didn't know how it's going to happen.
Mhm.
So I had to tell them, hey, because it took a little bit of time because they expected me to go right after undergrad. I didn't go right after undergrad. So they asked me, it's like, what's your goal? Like, they're like, if you're not gonna go to medical school, maybe you should go to a different, like, maybe do a different pre-med thing, like pharmacy or nursing and blah blah. I was
Yeah.
like, nope. I was like, nope. I want to go to medical school. This is how I'm gonna do it. So I told them, this is what I'm gonna do. This is the plan. This is. And so when I told them about my plan, they felt like at peace because they were like, okay, she has a plan. She's just not like wandering around.
Yeah.
And so I think explaining to them clearly what your plan is, it's because I think same thing with patients. Like patients, when they come for surgery for us, they want to know the plan. When you tell them this is the plan, this is what's going to happen first and second and third, they feel at peace. They know the plan. They feel settled. So just talk to your parents about your plan, what you're going to be doing first and next, and what plan A, plan B, plan C, and then loop them in so they understand. Versus like, just keeping them in the dark. So just talk to them. And so hopefully they will understand. Uh,
Agreed.
what else?
I think there's something for you, Dr. Betty. It says, oh, I think it's an appreciation post. Comment.
Okay, let's
What can I
see.
do to stand out and excel in clinical rotations?
Mm-hmm.
Show
That's
up early, be
yes.
prepared for every case. For rotations, if you're, I don't know, like for surgery, like round on your patients early, know all their vitals, like be well at presenting, learning how to present your cases very well during your rotations. I think that's important. But the key is being punctual, staying
Yeah.
late. Those are
Yeah.
the things that people appreciate a lot. And
Yeah.
working hard. Don't be on your phone. Don't slack. I
Yeah.
mean, you can go home and do that. Go home and, you know what I mean? Like when you're
Yeah.
there, be fully present, be focused.
Yeah.
Um, those are the
Yeah.
things I recommend.
Yeah.
Would
I
have to.
agree. Same. I mean, my rotations are a key portion of your medical training. Like this is where you can get good reviews, good feedback, good grades to get to residency. I can't emphasize that enough, especially in the field that you're trying to go into. So you really have to try hard. It's not one of those where you just kind of show up, learn a little bit, see your patient, and go home. No, you again, like Dr. Maki said, show up early. Like be the first one there. Your resident should not be there before you. Like if you should be the first one there, rounding on your patients. Give yourself time. Like the more time you have, the more time you have to talk to your patients, to get to know them, to ask questions, think about your differential diagnosis, have a treatment plan, talk to the nurses. You should really be, because usually, yeah, I don't know how many patients you guys carry now, but we used to carry like 3 or 4 patients usually, and that's a small amount of number versus residents who carry like 10, 12, 13 patients sometimes. So you have a small amount of patients that you're carrying, that you should have the time and energy and to really delve into their history. So it looks really good when you know something that no one else knows. That looks really good as a medical student. Like,
Yeah.
oh, my patient has a cat. He might have this disease because he has a cat. I don't know. Just like random things that
Yeah.
you can pick up. Or like, oh, I heard that, my patient's girlfriend said this and that. It's just like sometimes patient drama actually leads to diagnosis. You know what I mean?
Oh, that's
Uh,
so funny. But yeah,
you
no, it's
know?
awesome. Yeah, it's cute, and it just shows how much interest the med student paid attention and he
Yeah,
asked me a lot of questions. So yeah, it
yeah.
shows
So
initiative.
yeah, show
Yeah.
initiative, and then one other thing I used to do, what I thought the residents were really helpful, is when we rounded on the patients, on all of the patients, there's always a to-do list, right? Like the attending will be like, okay, plan today is to start this antibiotic, to trend the, I don't know, blood pressure or like urine output, whatever. There's a list of things that you're supposed to be doing for that patient that day. I wrote those down for every patient, as much as I can, at least, and then I'll just have them down, and then when I'm done with all the things I have to do for my patients, I'll just ask the residents, "Hey, do you want me to do this for this patient?" And they really appreciate that,
Oh,
because as a
yeah.
resident, you're so overwhelmed. And so when I'm like, "Hey, like, do you want me to call social work about this patient?" Even though you're not carrying that patient, there's no one really following that patient but your resident. They really appreciate that, and it
For
shows initiative.
sure.
That you're kind of on top of that, and you're making sure that things for the day is being done. I always tell them, when I was a resident, I used to tell my medical students, your goal is to get the patient out of the hospital. That's your goal, if you can. But that's really your goal. It's not a bad thing. You don't want patients in the hospital,
Yeah.
because the hospital is really the worst place you can be,
No,
you know?
exactly. It is
And
not a
so you just have to think, the minute you get a patient, is like, how do I get the patient home? That's the first thing you think about, is like, the patient has this issue, how do I get them home? So you start mobilizing all your resources to get them to home. So you just have to have that mindset, like, this patient is here for this, like, a pneumonia. Are they really sick? Are they not really sick? How do I get them home? What are the things they need to get home? What are the things that they need to pass to get home? So you just have to constantly think about that, just how do I make sure my patients get better?
yeah.
um Okay, I think we're way over our time. I don't know if there's anything else that you want to answer.
Yeah, not much. Just like I said, if you have the strong desire, be super proactive, work really hard towards your goal, reach out to people, ask questions. We're here. We'll help as much as we can. Don't be discouraged if things don't turn out to be the way you thought they should be. Just be persistent, persevere, and you will get there. Just persist, pray, work hard, and you'll get there. And Preeti, thank you so much for this opportunity. I had so much fun. This was awesome.
Thank you so much for
Yeah,
your time and your wisdom and insight. This is great. There's more questions coming, but we'll do another one, I'm
For
sure,
sure.
soon about specific topics. If you really like this, I'll post this video at the bottom. Comment on the topics that you'd like us to share about, and then maybe we'll go more deeply into actual medicine stuff and decide without causing a lot of controversy. I know some topics are very controversial.
Awesome.
Thank you
Well,
so much, Dr. Maki. Thank you,
have a
everyone.
bye, hon.
Bye. Bye. If you end this video. So, okay. So I'm gonna try to post this video. I don't know if I know how to do this. Oh, lordy. Okay, I'm gonna figure out how to post this video. Hopefully I know how to. Anyone, how do you save the video? Anyone knows how to save the video? Let me know. I think I just have to end it. Okay, I'll try to save the video, everyone. And if it doesn't, we'll see.